This podcast is hosted by Shevki Deyanov, your friendly neighborhood psychologist.
And Dr. Todor Kunchev, here our strange neurologist.
And together we are...
The Wrong People.
So, first episode.
Yeah, so...
What should it be for?
I was informed that it's going to be a neuropsychology episodes, so...
Or a neurology and psychology.
And psychology. Okay, let me ask you this then. You are Dr. Todor Kunchev, and you are titled as a neurologist. Can you please? Yes, please. Should I have to visit you when I'm very nervous? Doctor.
You should visit a neurologist if you're slightly nervous.
Okay.
If you're too nervous, it's about our evil big brother, the psychiatrist.
Psychiatrist, okay.
Yeah.
And how can I differentiate that?
Nobody can differentiate really easily who they should go to. So if you feel like you're in need of a neurologist, you should visit one. Mm-hmm. But a neurologist is just a doctor who had his residence in neurology, in contrast to psychologists who do what?
Well, psychologists, as you most probably know, that we are the shrinks or the crazy doctors, they call it sometimes. Unfortunately, still we have this stigma. But psychologists are working in many different areas, but mainly we are focused on the behavior, actually. It is the science of behavior. We are studying normal and abnormal behaviors of human beings and animals at the same time. And we try to understand why do we do what we do, so we can help people in certain situations. Of course, there are many different types of psychologists. It's a very wide range of professions like clinical psychology, social psychology. We have behavioral psychologists. We have
a huge tribe of psychologists.
Yes, it's very...
who are different from neurologists and who are different from psychiatrists. So yeah, let's draw the line here. A psychologist is someone who studied psychology, right?
Yes, exactly.
They're not a medical...
No, they're not medical doctors. They're not. They don't study medicine, unlike neurologists and psychiatrists. As far as I know, you have to study 6 years of medicine, and then you choose one profession in medical.
And then you retire. Because it's time for you to do that.
Yeah. You can choose neurology after 6 years. You can choose psychiatry after 6 years, and then you have your specialization. I don't know how many years after the...
4 to 5.
4 to 5 years, yeah. Okay. But in psychology, it's not like that, of course. We do study 4 years of... bachelor's degree, and after the 4th year, depending on your master's degree, you can choose to be more clinical one, like myself. You can study, for example, clinical neuropsychology.
Then what's the difference between a psychologist and a neurologist?
Well, the difference is huge, definitely. The studies you have, the studies psychologists have is totally different. We cannot prescribe pills. As psychologists, doctors can do that. We cannot take heavy cases. By that I mean that if the person that comes to us has literally a brain damage and it has a neurological problem maybe, or psychiatric problem, we have to refer them to neurologists, to a psychiatrist, so they can have a better evaluation. In a medical sense, I can say. So
a psychologist who cannot handle their patients sends them to a neurologist. And if a neurologist can't handle them, they direct them to a psychiatrist. Our big evil brother that we don't have here.
Yes. Actually, the differences between psychology and psychiatrist, because I have to make that clear, that many people are confused about psychologist and psychiatrist. Psychiatrists are doctors who works only on abnormal behaviors and abnormal cases, where we as psychologists, we also study normal behaviors. We study what do we do, for why we do it.
So you have people come to you just to talk to you and they have no problems?
No, not at all.
And they pay you up?
Hopefully, even if it's not every session, I like to have that. But yeah, not everyone has to be like, we have very normal people, just they want to explore their own emotions much better. They want to explore their capacities, their skills, and so on. But what about neurology? Do you have such kind of normal people just like saying, hey,
Yeah,
I very much like you, and today I have no problem, but I would like to...
Let's do a summary here. So a psychologist is someone who still helps people that have mental problems, right?
Of course.
And neurologists and psychiatrists are doctors. And then what is the difference between a neurologist and psychiatrist? I would usually do that parallel with software and hardware.
Okay.
Because in theory, neurologists should...
Can you please more explain to me what do you mean by software and hardware? Because
even a psychologist can tell the difference, right? Software and hardware.
We psychologists, you are a bit take slow and...
Yeah, the idea here is that neurologists should deal only with the hardware problems because all three of us deal with the brain, right?
Yes, exactly.
Neurologists should deal with the structural problems of the brain, or ideally. Of course, a neurologist would see anybody who looks for their help. But the difference here is that anything that is in the more broad and abstract mental health problem should be consulted by either a psychologist or a psychiatrist if the case is harder for psychologists to deal with. And the neurologist would be a bit lateral to all that. But what happens in practice is that we take a lot of patients that don't for any reason want to go to either a psychologist or psychiatrist because there's stigma about that. So yes, we also deal with the, let's say, psychological aspects of health as well, but we know our limits, and when we reach them, we send the person to a psychiatrist.
What are the most common complaints that you are having usually? The people who are visiting
in this regard, the psychological one, or more
overall as a neurologist?
The most we deal with is back pain, headache, vertigo, and so on. But when we speak about mental health, we have our cases of anxiety, depression.
Would it be anyway too much possible to do not have any mental problems if you have such a back pain? Like I really sometimes wake up and I really swear to everything and everyone because my back hurts so much. Thanks, with your help, it gets better.
Thanks to my help, your back hurts in the night.
Now it's even worse.
Only during the day.
It changes, but back pain, vertigo. You said. What are the ones that are more related to psychology? When do you prefer to refer your clients to a psychologist, to psychiatrist, maybe?
We sadly never refer people to psychologists.
Okay.
Which is a mistake, really. Because, yes, we deal with the lighter cases of anxiety and depression, insomnia, and so on. And we try to deal with that as best as we can.
Yeah, as far as I also know that actually many countries in different parts of the world are actually very much... Baron, babacığım.
And this is Dr.
Yeah, that is Dr. Baron. That is our lovely assistant who helps us to keep people happy and sometimes mentally stable.
We don't see him.
Would you please show your head? Sit. Yes. But no. Yo.
Had his several seconds of attention.
Babacığım.
We are, after all, dealing with the brain. all three
Exactly.
of those specialists. Yeah,
Exactly.
true. And one says we are working with the mind only or the software, and we neurologists say we only deal with the hardware. But this is really just an artificial separation, because science really tells us that mind and brain are pretty much the same, at least to a certain extent.
Yeah, we kind of a little had a chat before that. It's a bit difficult to draw the lines where the mind ends and the brain starts, and if the brain and the mind is the same thing, because for psychologists, for literally psychology means the study of the soul. But with all the scientific approaches now, we agree that many people goes far away from saying a study of soul. We tend to say study of mind, because soul, we cannot measure it, it cannot be scientific, so we have to be able to measure something, and what we can measure is brain, and in brain also we talk about the mind. Can you at least maybe try a little bit to draw the line between the brain and the mind? And
Sure,
it's very complicated.
This is something that hasn't been in any way. It's still a problem that medicine and the world is trying to solve anyway. But sure, we know that in the past, the soul and the mind were put in other organs. The heart was in the center of the thinking about the soul before the Middle Ages and so on.
Exactly.
And actually, Aristotle told that the brain is there to cool your blood, and that's why we're not hot-blooded as the animals. Of course,
Yes.
we now know that this is pretty much bullshit. But
Sure, the soul was located in the heart, around the chest.
yeah.
Yeah, but
Then
as you
things shifted and people started saying that it's around the pituitary gland and so on. But we now know that soul and mind are pretty much the same, or at least we think so.
Yeah, definitely. In psychology, we also do not make the differentiation between those two anymore. And soul, definitely, what we call soul, cannot exist without mind or body. So when it doesn't exist, we open the organs, we check the body. There is nothing seem to be like, I don't know, kind of a ghost that lays in us and it directs us. It is mainly our cognitive and motor functions in our brain, and how, because right now we also have way more studies and different perception about emotions, how the emotions are affected in the brain. So with the MRI, EEG, we can see how our brain functions exactly before the emotions are appearing, and so we have way more clearer idea of what soul is. I know it might sound a bit less romantic.
It is less romantic.
Yeah,
Sure.
it sounds very
You
academic.
ruined it for all of us.
You can still be in love, don't worry. The magic doesn't change just knowing that how it works. I believe it's even the opposite. I believe it is more magical to me the more and the more you know about the brain, because as we discussed before, literally the brain is the most complicated product in the whole universe, because it can observe itself. What we are doing when we are studying the brain, actually brain studies itself, and it is quite, even to me, it's more complicated than even quantum physics. And you can ask the physicists sometimes and they would say the same.
Is this all about the female brain?
Female brain. Oh, that is definitely a different topic. It is way more complicated than the male one, for sure.
This is what you should have said.
And that's why our second episode is devoted to the brain.
Yeah,
right?
definitely.
Yeah, but that notion is still challenged because more and more we know that any mental health problem is almost any mental health problem. Now we know that there is at least some microstructural problem in the brain.
Definitely.
And that takes out the romanticism of it all. But there's still several mental health problems that we don't know anything structural about it, that there's
Yeah.
no pathological lesion there and there's no genetic abnormality involved, so it still looks a bit romantic and
Oh, definitely.
like a curse and so on, but maybe it's just
That is
question of
exactly what
time.
I'm saying. It's magical because it is too complicated, and it doesn't matter how hard we study, we always find something that would amaze us. Sometimes, like you said, there is nothing structural problem in the brain, yet the person has a certain problem, mental health problem, and that still amazes me how complicated the brain is. And not only brain, but yes, brain is one of our organs, but as you
Is it
can
the
make
most
one,
beautiful organ of them?
that is very subjective, depending on what you like in organs.
What types of organs do you prefer?
Well, some things that you can squeeze. Well, you can squeeze the brain, right?
The brain is quite squishy,
Yeah,
actually.
squishy.
You know, it's actually compared to its consistency is compared to tofu.
Yeah, yeah.
So like pathologists like to play with.
Unfortunately,
I have to ask: is your favorite organ the brain in both males and females, or in males only?
Well, what was the name of the people who are attracted by?
Necrophilia.
No. Who is attracted to intelligence? What was it?
Yeah. That's smart people.
No.
You know, intelligent people like intelligent people, and
Well, okay, let's put it that way. Many people find brain very sexy. I mean, people to have brain.
maybe you should do just the.
No. Okay, let's.
Yeah, let's leave the brain for the second episode.
Yes.
We were speaking about the mind and the brain
Mind,
and
yes.
how they are
Let's
the
turn
same.
back, yes. Let's turn
And
back to the mind.
that both, I mean, all of us, neurologists, psychologists, psychiatrists, and neuropsychologists, which we didn't mention, all deal with pretty much the same, but they like having their own way and
Yes.
spitting on the other specialties, like we are going to do in that podcast.
Definitely. Especially, let's talk about neuropsychology or neuropsychologist, neurologist and psychologist.
So what the fuck is that then?
Let's put it that way. We also, as a psychologist, as I said, there are many different psychologists who are focused on not only brain, but also human behavior. There are psychologists, they don't have to talk about brain at all. Maybe they are just focused on social psychology and so on.
I've seen them trying to ignore that there is a brain. At least some of them.
I mean, not to ignore, but they are not interested in that. For example, in social psychology, we think that if we can, the whole world is a theater or there is a game playing, there is an act. And if we change the curtains, if we change the whole setup, then people's behaviors are already being changed. So we even don't have to mention brain at all. So
Very convenient. Neurologists hate that.
that is one part, but no matter what, even if you change the system, even if it's with social psychology, even with other parts of psychology, if you change the human behavior, maybe you would agree on that the behavior also has an effect to change the brain structure. Would you say so?
Yeah, absolutely. But then that means that you say that there is a brain and we are okay with that. So mentioning that it changes means that you say that there is a brain and we are okay with that.
Definitely. As a neuropsychologist, I am all about brain because brain is the main thing, And
So then again, what is a neuropsychologist?
Neuropsychologist is the psychologist who focuses on the brain and brain damages, brain problems, anything related to brain and psychology that we have seen different
So the
types of
smarter
behavior.
part of the psychology society.
Well, if I would say that, it would maybe offending my other colleagues.
We are okay with offending ourselves and others, I believe, in that
Well,
podcast.
come on, at the end we are wrong people. They
Really?
should, yeah, you know,
Sure.
they can.
So yeah,
they are here to
the
talk to
clinical
very wrong
neuropsychologists are the smarter part of psychologist society.
Only because they are neurologists. We take our intelligence from them because we have a lot to learn from them. The thing is that definitely, because our main focus is brain damages and brain problems related to psychological and mental health problems. So, for example, let's give an example. If the person has an Alzheimer's disease, or if the person has dementia type of Alzheimer's disease, definitely there is a part that you have to be involved. You have to tell me which part of the brain is affected and how much it is affected and how it is developed, how fast it's going, and you would definitely help me a lot to build up my case, but you do not have to work with that patient as I do work with them, because then once when you do all the medical examinations and so on, you do not have time also to follow up their daily lives. But as we know that they have a lower cognitive functionings, yeah, so they would need pretty much anyway they have to have a caretakers, you know, because this is a neurodegenerative disorder, so with the time it will get worse. So there will be those people are having extreme behavioral changes they are having. So at some point maybe they will forget to cook, they will forget to take care of their hygiene, and someone has to teach them and maybe the caregivers about what can help them to live a more comfortable, at least mentally not so much challenging lifestyles. So we take care of this part. As a neuropsychologist, we are more focused on the behavior and daily life of the client, and maybe you guys are in the more medical part and
Yeah, actually, in that regard, going back to the idea that neurologists dealing with the lighter mental health problems, like the not so severe cases of anxiety and depression, they should refer people to psychologists to continue their work with them.
Can our smart friends in neurology not find
the time
click, no, not the time, but the click, you know, maybe like to have kind of a button and then oops, and the whole Alzheimer and dementia stops.
We'll speak about that in another episode.
Okay.
We can do that. So we're leaving some people out then.
Yeah.
What about the neuroanatomy specialists, the neurolinguists, the neurodivergent specialists as well?
There are, I don't know.
Not part of our tribe?
Yeah.
Not cool enough to
they're not
communicate
with us.
with you?
They cannot sit with us.
Let's not talk about them then.
Yeah, we are neurologists and neuropsychologists. I would also try to keep the astrologists and all the personal coaches.
I will do my best to shove them in your face. Yeah, this is a podcast about astrology.
Astrology, yeah. Your zodiac signs are very important for your mental health problems. You should know that.
Indeed, they are. In the next episode, we're going to speak about your favorite organ.
The squishy one.
The squishy brain.
The brain, yes. Let's do that.
Yeah. Thanks for being with us.
This video has been brought to you by Nuance Psychology.